We ended with immunizations, and now we're going to hopefully finish up with the growth and development section talking about primary prevention. So stopping the spreading of the diseases is going to be by the utilization of immunizations. Immunizations help control the spread of diseases to other people across the continent, across the world. We do have good infection control policies that are instituted in facilities, and really good hand washing is going to be the #1 way that we prevent the spread of diseases. Infectious disorders, as far as communicable diseases, we have noticed a huge decline in many of these diseases with the use of immunizations. The downside is that many people are getting misinformed about immunizations, and so we are seeing some families use caution with implementation of immunizations. Complications have also decreased with the use of antibiotics as well as antivirals and antitoxins. As I did state earlier, we do need to use caution for our children that are immunocompromised. And so when we talk about contraindications and precautions to vaccinations, if you take a look at table 36.5, on page 988, you will see a nice listing of those. As you can see across the bottom, these are just some pictures that are also displayed in your book concerning the different diseases. Typically with chickenpox or varicella, over here we see that in children primarily under the age of 15 years. It does leave a threat of herpes zoster, which in turn is also known as shingles. The erythema infectionosum is also known as fifth disease, and the agent primarily responsible for that is the human papillovirus. Typically the child will present with a slap face appearance. That will typically disappear in about 4 days, and then they develop a rash on their extremities that lasts about 7 days or more. The rash does subside but will reappear if the skin becomes irritated again, or if it's traumatized by heat, cold, friction. And then roseola is also agent to the human herpes virus type 6. Typically roseola has an incubation period of 5 to 15 days, and the person will have a high fever for 3 or 4 days, and then after that fever subsides, this rash will appear. Typically the rash is on the trunk and then moves to the face and extremities. With measles, or also rubeola, this is a virus, and additional information must be given as far as the vaccine information sheet, and that is required by law per the National Childhood Vaccine Injury Act of 1986. So prior to giving the vaccinations, certain vaccines patients are required to give, nurses are required to give them the vaccine information sheet, or VIS, and you will see this especially when you go to OB Women's Health. Practitioners are required to fully inform families of the risks and benefits of vaccines, and you can see from this slide typical incubation period and what the patient then looks like once that rash appears. With mumps, that is transmitted via droplet or direct contact, has a longer incubation period, and is kind of hard to diagnose because of it has just general complaints of like a normal flu type symptoms. Families and children do need to be reassured that the recovery is going to be generally rapid with all of these diseases. However, visible signs may be present for some time after. So with chickenpox, rubeola, rubella, all of those types of things, we will see longer visible signs. Pertussis, or whooping cough, we are seeing the Tdap utilized because of the increased incidence of whooping cough. The patient typically has a crowing or whooping sound cough, and the downside of this is the complication of pneumonia, which will lead to the usual cause of death. And so we are seeing a big initiative for the utilization of the Tdap, so people are getting revaccinated for the whooping cough virus. With rubella, transmission is from direct or indirect contact, has a couple of week incubation period. Really, the greatest danger with rubella is its teratogenetic effects on a fetus, and so we do caution pregnant women to not get the rubella vaccine until they are in their postpartum phase or after they have delivery, and then we need to caution them to not become pregnant for about 3 months after they have received the rubella virus vaccination. Scarlet fever is a group of a hemolytic streptococci. Complications are a little bit greater with scarlet fever. We do see some cardiac involvement, and oftentimes if there is cardiac involvement, the patient will end up with a benign murmur. And then lastly, just think about injury prevention when you are thinking across the spectrum. As far as our pediatric client goes, the top leading causes of injuries to infants are typically falls, ingestion injuries, burns. The 3 leading causes of accidental death in the United States for infants is due to suffocation, motor vehicle related accidents, and drowning. And so the use of car seats is going to be very important, and vigilance is the key to prevention. If you look on box 36.1, it does discuss injury prevention during infancy. And as we look across our children that are growing up, nurses must be aware of possible causes of injury in each age group in order to form or to have anticipatory preventive teaching. We would like our parents to understand how, as their child would grow and develop, the different injuries will change as well. Preschool aged injury prevention starts early in childhood. If an injury has occurred, the nurse should not be too quick to judge the parents. Injuries aren't always going to indicate neglect. So if you think about that, think about children, especially your younger children, the toddler, preschooler age. You know, they're really hard to watch without being overprotective or confining them to a gated area. So parents just need to remember they can't anticipate every single danger that's out there, but we do want to reinforce what's harmful and what is desirable. Traumatic injury is the leading cause of hospitalization in the childhood age range, and infants and younger children are at a higher risk because of their small size and their inability to protect themselves. School age children, the most common cause of severe injury and death is related to motor vehicle crashes, either them being pedestrians or passengers. Take a look at page 1093 and 1096, and that does discuss some injury prevention in school age and the older child years. As far as adolescence goes, vehicle-related injuries are going to be of high incidence with them. Box 40-3 on page 1132 will talk more in depth about that. And then if you look at the stress injuries, you'll see that the next couple of slides that you have are related to the sports injuries and sports participation. Talks a little bit about stress fractures, so just take a look at that. We're going to end here, and we will discuss child maltreatment in the classroom, as well as the exemplars that are associated with the pediatric unit. So we will talk about pediatric assessment, pediatric nursing care. We will talk about cerebral palsy, which is one of the exemplars, as well as Down syndrome and failure to thrive. If you have questions, please don't hesitate to email me, and I will look forward to discussing the exemplars when we meet in class.